We're a not-for-profit organisation contracted to the Ministry of Health to provide care for people living in New Zealand with chronic hepatitis B. We also offer support and advocacy for people with hepatitis C. The Hepatitis Foundation came about because Sandy Milne, a head technologist at Whakatane Lab Hospital, discovered there was high rates of hepatitis B and acute viral hepatitis. This led on to the Whakatane team to investigate all blood tests coming through the hospital for other reasons, and they tested this for hepatitis B and found a high rates. So in 1984, the Kyra study, seroprevalence study, was undertaken, and they screened 93% of the population and found a high endemic of hepatitis B. This prompted studies into vaccination, low-dose vaccination, and because of all this work, New Zealand was the first Soviet nation to introduce universal vaccination for all our children. In 1999 to 2002, the largest national screening program ever undertaken was done, and they screened over 177,000 people and found over 11,000 people carrying hepatitis B. From all this work, the Hepatitis Foundation of New Zealand was formed, and in the 21st century introduced a free national follow-up program. The Hepatitis Foundation provides a helpline which is available to all health professionals and the general public. We also offer advice and support to anyone with chronic hepatitis or anyone in general. We provide resources and information. We have a really good website. We also have Facebook. We provide regular blood tests for people with chronic hepatitis B. So what we do is every 6 months we post a blood test form out to the client, and then they will take that to the lab to have their blood tests done. We provide access to specialist care if needed, and we also provide access to community hepatitis nurses. We do liver assessments, and this includes FibroScans. A FibroScan is a non-invasive, painless procedure that assesses the stiffness of the liver via a technique of transient elastography. Liver hardness is evaluated by measuring the velocity of a vibration wave, other known as shear wave, generated on the skin. The shear wave velocity is determined by measuring the time the vibration wave takes to travel to a particular depth inside the liver. If there is liver scarring, then this slows down the shear wave. It tells the operator whether or not there's no or minimal fibrosis, if there's moderate fibrosis, severe fibrosis, or cirrhosis, and then the operator can act accordingly and refer where necessary. The FibroScan now can be used instead of liver biopsy, which is a great thing because it's non-invasive. The World Health Organization is working towards eliminating viral hepatitis by 2030. New Zealand is one of the 196 countries that have signed up to try and achieve this goal. What the recommendations are is that they want to reduce new infection by 90%. They want to diagnose 90% of people. They want to reduce mortality by 65%, and they want to treat 80% of eligible people. So we all want to work in partnership together to try and achieve this target.